The Sexual and Reproductive Rights Network, hosted by Think Young Women with support from Amplify Change, commences a two-day national conference on sexual reproductive health rights. The theme of the conference is accelerating the fulfillment of women's sexual and reproductive health and rights. The conference aims to stimulate dialogue and discourse in the Gambia with various stakeholders on women's reproductive health and rights. Jama Jack, communications manager at Think Young Women, tells her institution's expectations from the two-day conference.
So we have just completed the development of a strategic plan for the SRR network, and as well as its accompanying implementation plan. And so this conference is also an opportunity for people to share their views in terms of what could go into that plan and what we would determine in terms of priorities for the coming years. And so coming out of the conference, we would want to have a better understanding of what priorities are at the top of people's minds. Because these are people who are also representing different communities, persons with disabilities, people living in rural communities. So there's extensive representation in the room. And so we will be leaving the conference with a clearer understanding of what priorities we should focus on, but also a deeper understanding of how we can ground our movement, strengthen it, build the membership such that we're able to work collectively to advocate for these very things that we're calling for.
Mr. Emmanuel Diouf, chairman of the National Human Rights Commission, says the Gambia is obliged to implement international treaties and conventions to respect and fulfill rights of women's sexual and reproductive health.
It's a party to many treaties and conventions, both at the regional and international level. And as a state party to these treaties and conventions, which provides for the sexual and reproductive health and rights of women, we are therefore obliged to respect, protect, and fulfill the rights related to women's sexual and reproductive health. These rights bestowed on women and girls is echoed in the Beijing Declaration and the Platform of Action, adopted in 1985 by 1995 by 189 countries. And it has been regarded by the UN as the most comprehensive and transformative global agenda for the achievement of gender equality and empowerment of women and girls. In its 8-page declaration, it not only states the kind of the inequalities and imbalances women are subjected to, but it also categorically states, and I quote, that the human rights of women include their right to have control over and decide freely and responsibly on matters relating to their sexuality, including sexual and reproductive health, free of coercion, discrimination, and violence.
Mr. Lamin Kamara, a representative from UNFPA, highlights what his office's survey on Gambia's reproductive health revealed.
The foundation towards attaining sexual and reproductive rights for all starts with providing young people comprehensive and expanded youth-friendly services and information, including a national in and out of school comprehensive sexuality education program, to ensure that they have the knowledge and skills to make informed choices and decisions regarding their body, their sexuality, including reproduction. More than 25 years ago, after Cairo, we have seen significant improvements in sexual and reproductive health around the world. Contraceptive prevalence rate has increased by almost 25%, and maternal mortality ratio is declining. However, the reality is far different from global averages with uneven progress in different countries, the Gambia included, in accessing modern family planning. According to our 2019-2020 demographic and health survey, the contraceptive prevalence rate in the Gambia is 19%, 20% in urban areas as compared to 13% in rural areas, with variations in different local government areas. The unmet need for family planning is 24%. However, for adolescents, it's a whopping 31.3%. As per the mix 2018. The high fertility rates, currently the total fertility rate in the Gambia has dropped from 5.6 to 4.4. However, this is still high, and this is being experienced in the country and could be attributed to the youthful age structure of the population and the low use of contraceptives among women of childbearing.
Meanwhile, Kajali Jani, a representative from the Ministry of Gender and Children's Affairs, says the Gambia government is committed to the promotion of women's sexual and reproductive health.
And I would like to call on you to continue to pursue a joint path towards achieving sexual and reproductive health rights for women and girls in the Gambia. Let us envision a Gambia where women and girls have access to sexual and reproductive health rights. Government of the Gambia envision a country where sexual and reproductive health rights are protected, realized, and guaranteed. We are all committed to a Gambia where women and girls have the autonomy to fulfill, exercise their rights without fear of coercion, violence, or harm. The government is committed to this and is taking steps to advance the sexual and reproductive health rights agenda.
Research reveals that adolescents and young people in the Gambia have limited access to sexual and reproductive health services. Healthcare providers, stigma, shame, lack of money, and cultural and religious misconception limit adolescents and young people's access to sexual and reproductive health in the Gambia. Reporting for Kerr, Fatou, I am Ladin Sise.